vaccine information session tonight. Thanks for everyone who is able to join us by watching live. If you do have questions, please go ahead and comment on our Facebook page, and we'll make sure those questions get answered tonight. So today we'll have Kathy Vo, a nurse practitioner with Gunderson Tri-County Hospital and Clinics, to give a presentation on the COVID-19 vaccine. Once she is finished up with that, we'll open it up for any questions. And following that, we have 3 stations outside for people to sign up for the COVID-19 vaccine, along with some handouts and information on what to do after you sign up. So again, thanks for joining, and I'll let Kathy take it away.
Thank you, Kayla. I appreciate the opportunity to be here with you and talk about the COVID-19 vaccine, and to give you a little bit of background as well on the virus. First of all, I want to thank Mark Zilmer, who put together this presentation. And I hope that it's helpful for you to understand how the virus works and then how the vaccine works. All right. So the COVID-19 is actually an acute respiratory syndrome from SARS, and some of you might remember that from the SARS virus from Asia a few years ago. But this is a SARS virus called COVID-19. It's genetically coded in an RNA sequence that's 30,000 letters long. So the RNA is inside that whole cell, and it exists in the cytoplasm. So these spike proteins land on the outside of that cell, or they attach to that cell, and the vaccines produce antibodies against that spike protein. There are other proteins as well that we're not going to get into. So the vaccine, the 2 vaccines, the Pfizer and the Moderna, are based on a messenger RNA vaccine. So this RNA is genetically coded for that spike protein, and it's injected as the vaccine, and then it goes onto that spike protein, and that's on the surface of your immune cell, and then those immune cells build an antibody to neutralize your body's response to that virus. And again, this just kind of shows how the viral vector vaccines, that would be like the Johnson & Johnson and the AstraZeneca vaccines, are encoded using an adenovirus, which is a little bit older technology. And so they work in a different manner than the messenger RNA, but they're still very effective. As we mentioned before, there are currently 4 vaccines that are in production. The Pfizer and Moderna use the messenger RNA as their immunization strategy. Both require 2 doses. With the Pfizer, the doses are 3 weeks apart. With Moderna, they're 4 weeks apart. The kind of the main difference between the 2 of them is that Pfizer needs to be stored at very ultra cold temperatures. The Johnson & Johnson and the AstraZeneca use that viral vector, that adenovirus. Johnson & Johnson is the 1 dose, and it's refrigerated and stored in the refrigerator. As most of you know, that is currently on pause as far as giving any of those doses because of the 6 cases of thrombosis or a blood clot that have occurred. But if you take into consideration that there were almost 7 million doses given, those 6 people that were affected, and there was 1 death, but the vaccine is still much, much safer than the virus. The AstraZeneca has not been given emergency use authorization here in the United States, but they are using that over in Europe. That is 2 doses, 8 to 12 weeks apart. Okay. Many of you have heard about virus mutations and what happens with those virus mutations. The RNA, as I said, for this virus is 30,000 characters long, 30,000 letters long. And if you think about sitting down and copying 30,000 letters, sometimes there gets to be a mix-up. You might put an A before a B or a B before an A. And that's how you get those variants. So when a virus mutates, the mutation can do one of 3 things to that virus. It can make no difference whatsoever. It can make that virus die. Or it can make it better able to survive and infect more people or cause new infections. So the viruses that have mutations or that have mutated are better able to survive and be more infectious, and they will be more common as we look at doing the vaccines. We are quite sure that we are going to need a booster to take care of these variants. And we have seen some of these variants in our own community in Trempealeau County. The B117 is the UK variant. You can go ahead and click. Okay. And that B1526, that New York City variant, was part of that Trempealeau County outbreak a few weeks ago. So that's my information. There have been other questions that have come up about should pregnant women get the vaccine? And the answer is yes. There is not a lot of data because, of course, a lot of pregnant women don't volunteer for the studies, but many have been pregnant, and it was either they didn't know that they were pregnant when they were in the study. But what we do know is that pregnant women often can have severe disease, and it can lead to like preterm labor or labor complications or complications for a pregnancy. So we do encourage pregnant women to get the vaccine. Other people have commented that the vaccine came out so quickly. And yes and no. I kind of liken the way the vaccine was put together, that they've been working on the technology for that messenger RNA technology since 2010. And so it's really 11 years old, that technology is. And if you think of kind of the basis of the vaccine as being kind of the bone broth for when you make a soup, and they can just add whatever ingredients they need to add in order to make that vaccine effective. Just like you can choose to add carrots sometimes to your bone broth, carrots or potatoes or cabbage, and the next time you make it, maybe you're gonna do carrots and potatoes and green beans. That's very simplistic, but I think it helps people understand what they can do with it. And this messenger RNA is a good technology. The Pfizer vaccine had 43,000 people in their research study, and that is not a huge number, but it's also not 200. The Moderna vaccine had 30,000 people in their study, 15,000 of which got the vaccine and 15,000 of which got the placebo. And so their data is also very strong. Again, it's not like having 2 million people in there, but it's still sound and solid research. Are there any other questions that people have?
Kathy, one question that I have heard a lot in the community is, will I get sick from the vaccine?
That's a very good question. Some people do and some people don't. You know, just as everybody has a little bit different immune systems, some people feel kind of under the weather for a day or maybe even two after they receive the vaccine. I can speak for myself. I felt under the weather for a couple of days, like just sort of body aches, didn't run a fever, and I had a little bit of a sore arm, but kind of like the usual sore arm you get from a vaccine, from a tetanus shot or, from the flu shot. Although I didn't even get a sore arm from a flu shot this past year. The recommendation is that people not take any ibuprofen or Tylenol prior to getting the vaccine. But after you get the vaccine, you can take some Tylenol or some ibuprofen. And that seems to make a big difference. After I got my second shot, my second vaccine, about 16 hours later, I just felt a little under the weather, nothing that I couldn't deal with. But I took one dose of ibuprofen and I was fine. But that's a really good question. Other side effects that we have noticed is that about a week after the injection, some people get kind of a red spot on their arm that gets kind of red and kind of warm. That typically goes away within a few days, and it's not an infection, it's just a local reaction to the injection. But those are the main side effects that I've seen and that I've heard. And again, I think the vaccines are very, very safe. When you take a look, in our county, we've had 39 deaths in our county. And that is 39 more people, or 39 people that we don't have on this earth. And I have a couple of patients who've lost family members, and I had one of my patients who died from COVID. And their families are devastated. One patient I have had 3 family members who died from COVID within about 4 months, and had a 4th die recently. So to lose 4 family members in a matter of 7 or 8 months is just unfathomable. How about other questions? One of the questions that had come up earlier was kind of a rumor, wondering about, or that they'd heard that once you get a vaccine that you'll never walk again. And I'm not sure where someone might have come up with that, but that has never been one of the side effects of the vaccine. Another one that I read was that when you get the vaccine, you'll have to be taken out of the clinic or taken out of that vaccination site in a wheelchair. Again, no, that doesn't happen. A third one I've heard is about that it affects your heart. Now, COVID-19 as a virus can affect your heart, but the COVID-19 vaccine, I have not read any research, and I've not seen anything about the vaccine affecting the heart. Another question that had come up was, can the vaccine be harmful to someone with underlying health conditions, like asthma, heart disease, chronic lung disease, that kind of thing? And those are the very people who need the vaccine the most, because they are the most vulnerable to die from COVID-19. So those are the people that we especially want to have the vaccine. Let's see. How long the vaccine will be effective? Well, we're not exactly sure. And part of that is because the people in the research study are just coming up on their 9 months, 12 months. So they have to draw antibody titers to see if they're still immune. Because the vaccine is newer, we don't really know how long it lasts. But as I mentioned before, I would expect that we're probably going to have boosters down the road, and maybe they'll do something even like combining a booster of COVID vaccine with the influenza, so that we get like one shot every year. We don't know yet. Trust the science, and we'll see what they come up with. They're pretty smart. Let's see.
One question that I get a lot in the health department and that I've heard circulating around the communities is that the vaccine will cause you to be infertile. So do you have any evidence around that or any comments?
No. I have not read anything about causing infertility. To the best of my knowledge, there is absolutely no correlation with receiving the vaccine and infertility, and the vaccine doesn't work that way. And so there was really no reason whatsoever that would be any correlation or causation. I think the other thing that I would like to stress is that make sure when you're getting information that you're looking on reputable sites, cdc.gov, look at the Trempealeau County Public Health website, look at their Facebook page. They're putting out information that is based on science, not based on rumor, not based on fear, not based on somebody's guessing by golly. They're putting out information that is based on scientific fact by people who have studied viruses for a very, very long time. One thing that I really observed over this past several months is that, to the best of my knowledge, we have not had a single case of influenza in our county. When I've talked with people at the clinic and said, is it just me noticing this? Because usually by January, we're kind of full swing on, like, you kind of can walk in the office and walk in the exam room and go, yep, you've got influenza. And not a single person has had that. I've also seen a lot less sinus infections, also many fewer ear infections in kids, and just in general upper respiratory infections, and that can be attributed to wearing this, washing our hands, sanitizing our surfaces, and really doing a pretty good job of staying away from people or not being around people that you don't see regularly. I think the schools in our county have done a really good job of having their students wear their masks and doing the disinfecting that is needed. And they have been able to have most of their sports sporting events, even basketball, even volleyball. And I think that that is really a tribute to the public health department and the schools and the school administrators to work together to be able to allow that. A lot of places in this country have not been able to have in-person school. And I think most of the schools in our county have for most of the whole year. So I think that that really shows some good participation from students and parents and the school administration working in conjunction with the health department.
At the health department, I have heard some people are concerned they can't get the vaccine because they're immunocompromised, but that's incorrect, correct?
Correct. Yes, the people who are immune compromised are definitely, again, the people that you want to get the vaccine. What is not known about that is how much their body will create the antibodies needed to protect them from that virus. And it's still way better for them to get the vaccine than to not get the vaccine. Oh, yes. I have heard this one too out in the community, that it's the government's way to put microchips in us. And if anybody's carrying a cell phone, they're already doing it. So, no, there are no microchips that are being implanted in our arms or in our bodies with this. Thank you. That's a good question. Okay. Well, thank you very much for being part of this town hall, and thank you very much to the Public Health Department for all their help and efforts, and number one, combating this virus, and number two, for setting these town halls up to get correct information out there.
Thank you so much, Kathy, for being here to share information tonight and to just help spread some good information. Great questions were asked and answered. So for anyone who is watching this live or recorded and still has questions, please give us a call at the health department, and you can leave a message at 715-538-2311, extension 220. And you can also visit our website for information on the vaccine and how to sign up for the vaccine if you choose. Thank you, everyone. Have a wonderful evening.